what this means for those who have been struggling and living with long COVID and what it could mean in the future. We were talking during that last piece that aired, and this is such a silent situation and how frustrating it must be for people that are still battling this. But walk our viewers through what this research specifically found.
And so it's really interesting to take a look at this because they noted that in the blood of people who were suffering from long COVID, who had had symptoms for 15 months or longer, that their cortisol levels were low. And that they also saw antibodies to mono as well as antigens in Epstein-Barr virus, which really suggests that there may be a reactivation of these latent viruses in people. And you know, if you've ever suffered from mono, you have fatigue and sluggishness, cortisol levels as well. If your cortisol levels are low, you're also slowed down and you have a mental fog. So cortisol really has to be carefully balanced. Too much cortisol in stress can lead to weight gain, especially around the center. Too little cortisol and your whole body tends to slow down.
Man, it's just so fascinating to see how different people respond differently to this virus. There were some, you know, when they tested positive, they felt totally fine. And then others, you know, that were just absolutely bedridden and couldn't really do much. Now, this may be a silly question, but when I hear of a virus laying dormant, right, in your body and then being awakened by this, is that the same as, let's say, like the chickenpox virus, and then it could be shingles? Like, is that how that works?
Right, so that's exactly the same concept. Because viruses never really go away, unfortunately, unlike bacteria, where we can treat them with antibiotics and actually rid them permanently from our bodies. Viruses tend to stick around. In some ways, that's good because it gives our body some memory when we fight it again. But in other ways, we can see how it can be reactivated. And it looks as if mono and EBV, Epstein-Barr virus, may be reactivated. The other possibility is that COVID, the COVID virus, SARS-CoV-2 virus, may remain dormant in reservoirs in certain parts of our body and then continue to reactivate in some subset of people and have these ongoing symptoms of long COVID. And you're right, it's been silent. These people are suffering. There are millions and millions and millions of people who really have not been able to return to normal life, and it is not being discussed.
Right, so what does this research then mean that we can, you know, finally put a name to it, right, and understand that this is very, very real? What does this mean for treating long COVID in the future?
The first thing I want to make certain that I say is that everyone should not run out and ask for cortisol shots. So
good.
The treatment is not to get cortisol. Cortisol is very finely regulated between our pituitary hypothalamus, and this is something that we need to carefully monitor. So this is just the beginning of finding out what's happening in our bodies, but the cortisol is not going to be the solution. So as we gather more and more data, we'll have more and more information and begin to really take a close look at these patients and how we can help them, including T-cell and B-cell lymphocytes, which they also noted as irregular in these patients when they studied their blood.
I know people that have been struggling with this for, you know, that long extended period of time. They're just waiting for anything. I will try anything. I will do anything just to feel slightly better. Okay, so speaking of COVID, there are reports out there that the home rapid test may not pick up the latest variant, which is always a concern, whether you're talking about vaccines or rapid tests. What does that mean, though, for the latest surge that we're hearing about and those government tests that are free to the public once again?
These tests will pick up the current variants. And I think what people are confusing is the therapeutics. So our vaccines and our monoclonal antibodies, those can sometimes be effective, more effective or less effective. And that is because that is dependent on the spike protein that can constantly change. As opposed to the tests are dependent on the nucleocapsid of the virus, which really changes much more slowly. And so what you see probably is that people are testing too early, and then the tests are coming back negative. The reason for that is we've developed some hybrid immunity, and so we actually may be developing symptoms sooner than we used to. We used to develop them around day 3, 4, 5. We may be developing them days 1 and 2, and we test, but our viral load is still quite low. And then that test comes back negative. So make certain you test again in 48 hours and then again in 48 hours. And remember, the PCR test is really more of the gold standard. If you're really unsure, go to your doctor's office and have the PCR test. But we really should have confidence in these tests, and they can pick up these current variants, and just make certain you understand where you are in your symptoms. And early symptoms, because of all of this hybrid immunity that we have, may not mean that you have a high viral load yet.
Right, or I mean, it could be the flu, it could be anything. I mean, it's that time of year too where you just don't know. All right, as always, Dr. Jane Morgan, Healthy Morning contributor, thank you so much for your insight. We appreciate it. Always see you. We'll be right back.
Healthy Morning, sponsored by